Okay.
Thank you. Here we go. I'm excited. Thank you. Yeah. Good evening and welcome to Medical Mondays with Dr. O. Again, still pardon my voice. It's almost all back though. You're muted, sir. Were you saying something?
I said almost 100%.
Almost 100%. Thank you. I'm Dr. Toyin Opesanmi, and I'm a family practitioner in Maryland. I treat HIV and I treat addictions also. I have fun, just not knowing who is coming in, and let's do it. But I enjoy these sessions every Monday where I come to learn and also impart. We learn a lot on Medical Mondays with Dr. O every 7 p.m. on Mondays, where different speakers come to teach us about prevention and intervention in different disease entities. Tonight, we have three speakers. I am included, where we're going to be talking about childhood behaviors that are usually misunderstood. They're usually misunderstood as truancy or defiance or just a child not being cooperative, but they are medical red flags that mimic behavioral struggles. So we're going to have tonight Dr. Kehinde Elisha and Dr. Ajagbe, but I'll go first. I'm going to start this just to share my childhood story and we'll take it from there. So I remember as a child that I never ate chicken skin. And I said never because that's as far as I can remember. But the truth is, I must have eaten it and have some kind of reaction or unpleasant experience that made me not want to eat chicken skin anymore. Now, to state that statement more correctly, the fact is, as I was growing up, I realized that I didn't like to eat chicken skin. And when we serve chicken at home, I will remove all the skin, including, the yellow parts sometimes, those yellow parts in between the skin and the flesh. I will remove everything and just eat the flesh. And I remember my mom always saying, look at her. She's not eating the best part of the chicken. And she would take the chicken skin and eat it. So fast forward, Dr. Olodun, who is a Medical Mondays with Dr. O family and has been here several times, a naturopathic doctor, also a veteran, came to visit one day, came to visit me at home, and they were spending the weekend, and she asked if she could do some testing on me, naturopathic testing. It was different, different from the allopathic stuff that we do. And she did all these manipulations and then told me that I can't digest fat well. So I asked what she meant by that. She said, things like avocado, you cannot digest. So I said, wait a minute. I love avocado. I still love it, but I don't eat it anymore because every time I eat avocado, I get nauseated. And as I continued to eat it, which was almost every day at the time, the nausea worsened. So I stopped eating it. So when she said avocado, I shared that with her, and she said, well, that's why you can't digest fat. Then I remembered chicken skin. And I said, wait a minute, is that why I could not eat chicken skin? As a child, I could not verbalize what I felt. And honestly, I cannot tell you if I felt nauseated or if it was another symptom that I had. I just know that I didn't want to eat chicken skin, and I didn't eat it. And my mom was always, my mom was always teasing me. If you know my mom, she was a teaser, and she was always teasing me. So I was blessed because I wasn't chastised, I wasn't traumatized because I wasn't eating chicken skin. But for some children, they didn't have that luxury. They actually have medical issues or, inability to tolerate certain things and will get punished, disciplined for that, get ostracized and, all whatnot. It's why we're having this topic tonight. So I wanted to start with my personal story. And now, if you have any questions, you can ask. You can ask me, I'll answer on that. Otherwise, I would defer to Dr. Kehinde Elisha. And you can raise your hand to ask the questions, or you can put it in the chat box, whatever is most suitable for you. But your questions will be answered. So, Dr. Elisha, I'm handing over the baton.
Okay, I'm right here. Just 1 second, please.
So, as Dr. Elisha is getting ready, I just wanted to add that I found out later in years that chicken skin is actually fatty and increases the bad cholesterol, the LDL. It's actually not a good thing for us to eat. So my body is so, what would I say? My body has been attuned.
Discriminating.
For you. Mhm.
My body correctly discriminated because it set me up for success, and I'm grateful.
Yeah. So
You ready, Dr. Elisha?
I am now. Thank you so much for the opportunity. I had to shift gears a little bit because of my reception. Thank you so much for having me again, and it's always good to be here. That
Thank
was
you.
a very, very good story right there because you're so right. I think that what really triggered this story was we had a deep discussion on how some kids actually suffer even till date for things they have no control about. And unfortunately, too, parents don't really, I can say, they don't have the understanding of what is really going on. In the process, to the parents, to them, in the process, they are disciplining the child, but in the process, the child is suffering too and developing some kind of resentment, especially for some things that are really big punishments to go for. And that kind of was my story. And as a kid, I remember actually being slow, and I didn't know why I was so slow about everything. But I do know one thing though, just being in medical field, and now I'm looking back, it's consistent with rights. So when I enter a bus to go to school, when I'm coming from a bus to get home, when somebody takes me in their car, and I notice my body is very, very weak. And when your body is very weak, it takes a lot of time for you to really recover. And that is called car sickness. So I actually had car sickness. You know, how in the world will anybody in Nigeria believe in car sickness when they don't even believe in allergies? So of course, that concept then, I guess, it was not that popular. Even in America, I don't think it was that popular for so many, many years. But at least they have more research that they've done here to kind of come up with that concept and even spread the word more. So how does it really feel like when I experience this? I enter the bus, I feel all right. By the time I get to school, I feel so dizzy, feel like I'm gonna pass out. They were linking it to learning disability actually. Because I failed every test. I get spanked. If anybody fail a test like the first few minutes of class, I'm the one. Because after class, this was the elementary school, by the way. Because after class, after school, my teacher then, I remember Mr. Opoku. He happened to be a Ghanaian. Very brilliant teacher. I went to Olumau Nursery Primary School in Ilorin, Kwara State, as a matter of fact. I will never forget. They call it discipline. I call it a torture, pure torture, because I was beaten with a cane every morning. That special number assignment that we were given to make sure that we must get it right, we must not miss it. Guess what? I am too weak to attempt it. I am weak, guys. I am weak. And they call me slow. They call me stupid. They call me dumb. I was stereotyped. I was stereotyped as a kid. And of course, I was big and chunky too. So the body image also came from that. Big and stupid. Oh my goodness, that's a lot. That's too many things to combine. But when I started to grow up, I realized, oh my gosh, car sickness actually exists. When I came to America, of course, that was when I had to trace my step back. And I want to encourage everybody here today. If you're going through something right now, trace your step back to your childhood. Find out the way you grew up, the environment you grew up, what you were doing then, what you were experiencing then. Just trace your step. That's called psychodynamic therapy, actually, in psych. But now I had to trace my step back. That okay, this car sickness, I think I experienced it as a kid. I think that's what it was. I feel weak, come back, come out, and it takes me out a long time to get out of that weakness. And then I can't do anything. And then they call me. I just want to sit down there and close my eyes and chill out. But how can you do you want to tell you want to chill out in Africa? So you're just trying to force yourself to do whatever they're asking you to do, but you know you can't keep up. You know something is not right, but you can't explain it. Same thing right now. I feel like there are millions of kids out there. They don't know what's going on. They cannot explain it, but they are being judged for the way they look. So I'm just saying we need to start taking a step back as parents too, as teachers too, to kind of get we're not in that kid's shoe. We should start paying attention to some subtle signs like this, some small signs like this, because it's really real. Now, every morning when I get to class, what happens? They beat me with a cane. It's not some dry cane. A cane is called pankere, is soaked in water. I am always one of those students that will just always get that question right. So guess what? I dreaded school. Oh my gosh. It was not my favorite because I knew I was gonna get beat. And it's not because I don't know. I can't explain the weakness. Dr. Oh, maybe you can help me. Has anybody here ever been car sick? I can't explain the weakness. The weakness feels like this. Maybe start okay, wherever you are right now, if you're less than 30, stand where you are now and spin around and spin and spin and spin and spin and stand still and see how you feel. You're going to feel dizzy like you want to fall. You're going to feel lightheaded. You just feel sick to your stomach. But guess what? As soon as the motion stops, you start to recover. But you need that recovery time that many people don't get. Okay? Coincidentally, I happen to have, a couple of my boys actually happen to suffer too from car sickness. So I get it from that perspective, though. I do get it. I try not to get them rushed right when we get out of car. I know how to manage it. I know they have to close their eyes, use some, of course, we kill it off with Benadryl. Scopolamine was recommended by Dr. Who the other day. That would be the best so you don't sleep off your life because of car sickness, when you're in a flight, still even as an adult, I'm in a flight, I sit in the wrong seat, I am done with that flight. I am like getting up and even on emotion. The flight attendants, I put them to work, everybody's freaking out, like as in, so that is me as an adult, that I have a little bit of control of my life. So now you can imagine how I felt as a kid and the suffering that came with it. You know what I mean? So that was my experience. And I cannot imagine a lot more symptoms that kids cannot communicate. So I think we need to start looking beyond, especially if there's a pattern that kid is showing. If there is a consistent pattern, discipline is great. Don't get me wrong. Let's not start taking everything to discipline. Oh, I got to get spanked. Let me use some verbal words to knock your life out of the way, to straighten you up. No, 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 no. It is just not the way. It is never my way. As in, maybe because I'm a little bit flexible type, it's just not my way. Because kids can communicate, so we need to find a way to look beyond. Thank you.
Wow. Thank you so much for sharing. And look at you today. You don't even just have, how many doctorates do you have? How many master's degree? I mean, you just keep piling them up. The master's, then doctorate. Thank God that your journey ended up that way. because with that motion sickness being branded a dummy, you know, spanked all the time, for people who didn't have opportunity to leave the country, to come out and start afresh and find yourself, can you imagine where you would have been today? Probably a hawker somewhere, hawking something. We
Yep.
never know. So it's very, what you just shared with us is so deep and so important, that when we have kids around us and they're not performing, or there's no way you could verbalize that you were fatigued or tired at
Correct.
that time. You just knew how you felt. But tell an adult in the morning, after you just got to school, that I'm tired, they would ask you, what kind of work did you do overnight?
Correct. Not, not in Africa, please.
I mean, in Africa, what kind of work did you do? Who
I know.
sent you to the farm? You don't go to the farm. What's your issue? It's what it would be. So thank you so much for sharing. You reminded me of my dad before I bring Dr. Ajagbe on to share his story. My dad, I heard later on, after I diagnosed him in his maybe 60s or 70s, I don't
Mm.
know, probably 70s or 80s, that I diagnosed him as having, claustrophobia. They used to take the train from a township called Abeokuta to Lagos and back. And I was told that my dad could not sit in the cabin. He would stand in the door, in the doorway of the train, moving train, hanging onto the door so the air can, it can enjoy the air, the breeze. But what they thought was that he just didn't want to sit in the train. Thank God he wasn't disciplined or forced to do it. And I think he was old enough at that point that parents were not going with them. He was with his cousins and all of that. Fast forward, when I asked him to come visit us overseas, he won't come. Then I
Mm.
forced him once to come, and one thing led to the other. And I found out that my dad was claustrophobic.
Wow.
So I would sedate him, give him medications. I tell them what to get in Nigeria, have him sedated, a benzodiazepine before he gets on the flight. And then he sleeps on the flight, and he also calms his anxiety for him to be able to fly back and forth. But can you imagine it took that long? It took a daughter that is a doctor to finally diagnose him. Otherwise, he would have gone to his grave not knowing why
I
he
know.
hated flying and he loves Nigeria. And he would say it all the time that Nigeria is the best country on the face of the planet. And, these things are very important that we pay attention to, diagnose them, and be able to manage them so that people would have good lifestyles.
Mm. That's the word. Good lifestyle.
Yeah. So, Dr. Jagbe, over to you, sir.
All right. Thank you for the intro, Dr. O and Dr. Elisha. My journey began pretty early in life. My parents told me that when I was born, that anything made from corn made me sick. So they recognized it very early. Um, so for the first 3, 4 years of my life, I think I had only one or two foods that I could tolerate. So they were trying to manage it. They didn't know what else to do. And if you grew up in the 50s in Nigeria, in western region of Nigeria, there is no way you can avoid anything made from corn. I mean, you can't really. You can't avoid it. Because that's if they don't have it twice a day, they have it at least once a day. And for most babies, they had to put them on their lap sideways, laying flat, and they will block their nose to feed them with pap. And it was a very, to me, it looks like a punishment. When I grew up, I couldn't stand watching any mother feeding their baby like that. I mean, I would protest wherever I could. But that was the way, that was what I was supposed to be experiencing as a baby. But anyway, so to fast forward about 3, 4 years into my early life, I think my stepmother, noticed that this child, wasn't eating anything else other than one particular food. And she decided to kind of try to woo me into eating stuff. So she started with yam, and she said she peeled the yam, she showed it to me, she cooked the yam, and then she showed it to me and said, "Okay, this is what the yam tastes like." So she mashed it a little bit and asked me to eat it. I think it was difficult for me uh, to take it in because it was like a shock. So I I think she went on. She said, "Oh, they said they killed a chicken. They boiled it. They said, okay, this is what chicken tastes like when it's being boiled. After it's been boiled, it's not yet cooked into sauce or stew. This is what it tastes like, and this is what they then showed me how it tasted after it's fully cooked." So somehow they knew I was very curious as a child. I wanted to know what was going on. At about 3 to 4 years old, I was already kind of understanding enough that at the age of 5, I was put in a boarding school. So now imagine what kind of food would they serve me in boarding school?
Hmm.
My parents were not there.
Mhm.
And they couldn't, I mean, whatever they told them, I didn't think they were going to adhere to all the instructions they gave to them. So I was one of the pioneers of, children boarding school in Oshogbo. I think it was 1960, 61. And it was a very interesting experience. I didn't have a mother to go cry to when something went wrong. And I remember still now that I was having hives, urticaria. They used to call it a besi then as a child. I had it every day of the week. I had urticaria on my skin. So by night, they will put oil on my body. I'll be shining like palm oil man. Anyway, so that was all I knew when I was growing up. The other thing I noticed when I was growing up was that I was very slow with food. I never rushed to eat any food because I will pick on it, I will look at it, I will wonder how my body will feel when I ate them. So if we were eating as a family at the dining table, I'll be there like 1 hour after everybody else has gone up. I'll still be there. And they gave me all kinds of names like they gave to Dr. Elisha. They called me all kinds of names, slow pokes, this and the other. I didn't phase me because I knew I wasn't going to be able to eat this food. They forced me to eat some food, but I wasn't tolerating them very well. I didn't realize that my body was already discriminating against things that were making me not to feel good. And I thank God for that opportunity because if the body was not discriminating, I could have easily died very easily, from eating the food they would have forced me to eat. Now, fast forward to 2011, 2012. I mean, 2011, I think it was, when Dr. O finally diagnosed um, my allergies. And it was very interesting. I think I've shared this story here before, but I'm going to share it briefly. She had seen me. We used to go to the same church, and after service one Sunday, I was talking to somebody in the rotunda, which is like a receptacle of the church, and she was talking to some other people. I didn't know who she was. She didn't know who I was, but she noticed that I was standing very uncomfortably. and I was wheezing loud enough that she could hear me where she was. She walked up to me and asked me, "Sir, are you okay?" And rhetorically, I was about to say, "Are you, can't you tell, that I'm not okay?" So she looked at me and said, "What's going on, really?" I said, "Well, I can't breathe well." And my shoulders were up because this was the only position I could be to be comfortable. And this was going on for many years. Now, remember 2012 or 2011, how many years ago was that? 14 years ago. And I'm 70 now. I was already 56 or something at that point. So that meant I suffered all the way through to that point. Now, the asthmatic experience I had was so severe that every time I said, "Let's go out to eat," we will go out to eat as a family, and I will end up in the emergency room. That was like routine. And the moment I go to the to the ER emergency room, they have to hit me with as much steroid as they can to open me up real quick, and then start treating me slowly to make sure I'm able to have my lungs opened again because my lungs will be shutting down. Anyway, at that point, when Dr. O insisted that we should see that she would take me to one one specialist who is allergist in Baltimore County. She took me there, and before we went there, she told me. I'm skipping a lot of things because I don't want to bore you with a lot of details. Anyway, the first day I went to Dr. O's office after she met me at the church, I went into a big asthmatic attack right in our office. And thank God she had a nebulizer, she had a medication, and she was able to open me up after about 30 minutes of nebulizing. Nebulizing is just like a big word for taking medication that can open one's airway to breathe properly. So after that, she said, may I recommend that you do an allergy test? And I did the allergy test. It was the panel allergy test. And when she got the report or the results, she said she screamed that she can't believe what she saw. So she called me. She said, "Your result is in. Can you come?" Oh, so I was like, "Okay, tell me what the result says." She said, "No, you have to come in." So I scheduled an appointment to go see her at the office. And she told me it's not something she could tell me on the phone. I had to sit down, that we had to go through the result. That almost every food that every Nigerian or African survive on, I was allergic to. Say, how did I survive? How did I live to be at that age if I was that severely allergic to those foods? Well, she looked at me and said, "So how are you going to survive after now that you know this is going on?" So I had to remind her. I told her, I said, "Look, don't worry, I'll figure something out." And what I did was as soon as I got the result, I went to a grocery store. I spent about 3 hours scouting the whole aisle and as many shelves as I can see to see what kind of food I can now eat as substitute to what I couldn't eat. Now, mind you, all these things that they told me when I was young that I should not eat, of course, I ate them. I mean, one of the things they told me not to eat was corn, right, as a child. If you grew up in Nigeria and you grew up in the Southwest, you knew what was called guguru and ekpa. Hey, guguru and ekpa was something you cannot, in fact, as a child, even till now, even though I now know that I'm allergic to corn and peanuts together, individually and together. There was nobody who could stop me from eating those two. Now, why am I pinpointing those ones in particular? I remembered when I was young, when they told me I was very slow, there was something that made me to be slow. One of them was breathlessness. I got breathless so easily. And I didn't know what it was. Nobody knew what it was. Even when I was in the medical school, nobody knew that I had severe allergy because it wasn't something that was done uh, routinely. Even when I was teaching at Howard, I went to all the different specialties at Howard Hospital about my asthma, and there was nothing they could do. They didn't even think about panel allergy tests, probably because it didn't exist at that time. But anyway, the moment I knew what it was, I looked back. I said, oh my God. So that was what was the problem. Dr. O gave me the list. Immediately, I quit everything cold turkey. Everything. I didn't even argue. I didn't even try to figure out a shortcut to it. I said, nope. Once I was spared, I have a second chance to survive. I have to abstain 100% from all of these things. Believe it or not, I've not eaten rice for 14 to 15 years now.
Wow.
I've not tasted rice, and I don't miss rice. I don't miss corn. I don't miss peanuts. I don't miss tomato. I don't miss shrimp. I don't miss crayfish. I don't look. I'm telling you about the long list of the things I used to eat. I used to buy this thing with my own money, and I was killing myself. And the moment I decided to quit cold turkey, do you know I recovered? I recovered so well that I can't even imagine myself going back in that direction that I came from. Now, Dr. O will insist, Dr. Ajagbe, you have to carry a rescue inhaler. You have to carry a rescue inhaler. I told her, I said, yeah, I agree with you. I carried rescue inhaler for some years. At the end of the expiration date, I would throw them away, not used. Because I abstained completely. I didn't even get enticed. I didn't get, tricked into eating any of those things. Now, if I went anywhere, if I went to, let's say I went to a restaurant and there was cross contamination with my food, do you know immediately I put that food in my mouth, I knew. As soon as I put it in my mouth, my system will start responding by thick salivary secretion. Wow. Immediately I will say, what was you put in this food? And once they told me, I would say, I can't eat it. And so, and that is how I have been since the diagnosis. When I now look backwards, I can tell you, people thought I was such snob. They thought I was too picky. They gave me all kinds of names. And I remember my parents telling them at the boarding school when I was in high school that there was some food I couldn't eat. And many people didn't know that they could accommodate somebody like that. I guess because my parents were forward looking, and the school actually accommodated me. They cooked my food, and a few other children that came from abroad. They cooked our food separately, and we served our own food. They didn't allow any other utensils to go into our food, and so I will go into the dining hall, serve my food, and sit down to eat without any complaint. So now, can you imagine if I was sent to a school where there was no accommodation for that? Now I'll be forced to eat all of the things I shouldn't be eating, and I'll be in the hospital almost all the time. And then they will be saying he's a very dumb very stupid boy. He has learning disability. He couldn't do anything. I love sports, but I couldn't really participate in an active way. Every time I tried to do it, I was totally breathless. Now, it made some sense when I went to the allergies, Dr. O recommended, and she made sure I went by taking me there because she said, you may not go. Say, I will take you there. She took me there. When they did a spirometry, that is a special test they test to check the strength of the lungs. When I did that and they aged my lungs, they said I had an 86-year-old lung.
Ah.
Yes, so that was 14 years ago. So now, if I was going in that direction, I would have expired long time ago. It would not have. I would have easily just slept and I'll wake up. Now, I didn't go into the details of the suffering I went through when I was having asthma, when I was having asthmatic attacks. There was no position that was comfortable for me. The only position I could tolerate was to kneel down at the at the foot of my bed and press my chest against the edge of my bed. That was all. That was the only position I could be all through the night. And if I was able to sleep for 2 hours, man, I was so fortunate. But most of the time, I looked angry. Everyone that looked at me thought I was always angry. Why is he always angry?
You still
Well,
look angry.
thank you. In fact, I'm trying to be very angry right now. But anyway, so my eyes were always very red, and my shoulders were up, and they didn't realize that I was trying to breathe very shallow and be able to at least breathe at all. Because if I took any deep breath, I will go into spasm. I will start coughing for the next 10 minutes. So I couldn't do any deep breathing. I could, in fact, I had to walk away from anything that was funny. Because if I started laughing, I would end up in the emergency room. There was no way I wouldn't end up in the emergency room at that time. So I'm very grateful, to God for creating me the way I've been created. However, He programmed into my body the discrimination of things that could make me sick. And I am so grateful for that. How I survived through all of that time, it's His own grace that kept me through that. Otherwise, I would have been dead long, long, long time ago. So I'm grateful for the opportunity to share this with you. Now, if any childbearing parent is on this call and you are observing your child behaving very strange, you don't agree with them, you don't assume that they are trying to be very non-compliant. Don't assume that they're trying to, ignore your leadership or your training or your discipline. No. If you can't find the right pediatrician to discover what may be going wrong, I think you should keep on looking. At some point, you find out that a child doesn't just want to be rebellious or non-compliant because they choose to be. Particularly if a child is very slow and a child doesn't eat everything everybody else is eating. Um, let's be very sensitive to their needs and see how we can help them to become matured adults who are productive and very fruitful in life. Thank you for letting me share.
Thank you so much, Dr. Ajagbe, because you are indeed a living miracle.
Thank you.
Thank you. I'll say more in a minute. Madam VP, our Madam CEO.
Yes, ma'am. Dr. Ajagbe, thank you for that wonderful story. This is the first time I'm hearing it. I heard teeny, beeny, tiny of it from Dr. O. But two things for me today is, nobody knows it all. Even you being a medical doctor at the time that Dr. O encountered you, you had no idea. You couldn't self-diagnose yourself. You had no idea. Can you imagine how many people have suffered? But second thing I want to say is, Dr. O, really, Dr. Ajagbe's story now even validates your Shiro's award. Whatever Hero and Shiro.
Cheryl. That's cute.
It's
Or
ringing
Daryl.
now because
Or Daryl.
where these men are just so chauvinistic. I don't know hero all the time. What about the she? She's a Shiro.
Okay, you're fighting
So
women. I love.
I know, but that Dr. O deserves a lifesavers award. Honestly, can you imagine? Even though Dr. Ajagbe, because of his knowledge and drive for research, turned things around with all his effort, he was just into it. But can you imagine what could have happened? All the things that we have learned from Dr. Ajagbe on this forum probably wouldn't have been cut short. We would not have had that opportunity because the guy himself was suffering. So, Dr. Ajagbe, thank you for sharing that story. Honestly, it's really it touched my heart. And Dr. O, we love you. Continue saving lives. So
Thank
I
you. I
know.
love you.
So, Dr. Ajagbe, all the things that you could not eat, let's have a party. We will eat it for you. You need to all the corner.
Don't
Or
worry.
just
Don't worry. Don't worry. You see me on Thursday.
by the grace
Yeah,
of God.
by the
Yes,
grace
sir.
of God.
Yes,
And
sir.
in case I don't remember, because this happens, we will not be having Medical Mondays with Dr. O on Monday next week. We're going to take a hiatus, a break, because we are going to a fantastic, God ordained, God blessed already wedding um, in
From
California.
Cali.
Here we come. So, and I'll be flying back on Monday. So we will not be having Medical Mondays with Dr. O on Monday. Madam CEO's daughter is getting married. So it's all hands on deck. If you want to come, private chat me. I'll sneak. I'll snitch.
Apologize, ladies and
Congratulations.
gentlemen. I
Congrats.
apologize.
Well, I
It's an honor for Dr. O to cancel Medical Monday for that. I apologize, ladies and gentlemen.
No,
So
no,
in good
man.
faith. It's in good
Yes,
faith.
yes,
Thank
please.
you.
No
Thank you.
apologies.
Thank
Yes,
you.
I'm going to represent the Medical Mondays family, but a lot of us in the family are going. I know Dr. V is going to be there, Dr. Ajagbe, and Mr. Kusonya, and Prince Maduka. A lot of us are going to be there.
Mr. Lawal, yeah.
Mr.
Doctor,
Lawal,
oh, you didn't tell me. You know my kids are in California.
you didn't ask me.
Yeah, I'm just joking. Congratulations, Madam
Madam
President.
V. That's my sister Rosemary. It's not too late, it's this.
It's already it's well.
Yes,
Congratulations to
we're
her family.
excited. Thank you. Thank you. So I want to go back to Dr. Ajagbe. Dr. Ajagbe, I just quickly checked and found that skin allergy testing has actually been in existence since the 1800s,
mhm.
since 1869, and got improved, few years, 1908, 1920s, 1950s, 1963. And the allergy testing I did on you, the lab, has actually been in existence since the 1960s, 1963. So this is an important detail because when a child, like we've discussed, Dr. Elisha had said it, Dr. Jagwe had said it, when a child is branded slow or, they're having difficulty breathing, and children cannot usually verbalize or articulate
Mhm.
how they feel completely. Even most adults in medicine, we would actually write in our medical notes sometimes that this person is a good historian. What we're saying is that they are able to communicate their symptoms well.
Mhm.
Most people cannot communicate their symptoms well. And we diagnose 80% of our diagnosis, rather, is from the history that we get. So you actually help us with the diagnosis. So how can a child appropriately articulate that when they are in a vehicle, like in the school bus, it feels like they're spinning and they get fatigued when they get to their destination. Or a child articulate that when they eat something, they can't breathe. They just know that Dr. Jagbe's shoulders were like this all the time because that's the way he can breathe well. I remember that he shared the story that even his wife would think that he would not make it through the night sometimes. You know, he's a living miracle. For whatever reason, that testing was changed. So I'm asking that please, as parents, even for ourselves, not just, as parents for children, let's be proactive. If the doctor does not remember to do a certain test, request it and we'll do it. We don't know it all. And we don't always remember everything. Remember, we see so many patients. So if you are proactive, it's actually helpful. And the reason we decided to discuss this tonight is because we've seen a lot of people that have these issues in their childhood or even now, and they're not getting attention. So if there's anyone in the audience who have something to share about their childhood or adult story, please raise, raise your hand or unmute and please share with us because we want to hear your story. We don't know who may learn or what we could all learn from that story. If you have experienced this in any way, anything similar, or if your child is going through something like this, kindly share with us now.
Dr. O, may I add something?
Please.
Yeah, I just want to mention as adults, we have control over what we buy, we have control over what we choose to eat. Sometimes we hear, oh, that restaurant is so good. You have to, in fact, you just have to visit. You have to go eat there. And then based on word of mouth, you hear it and you just go. And if you took a bite or you bite you start eating and all of a sudden you start feeling thick saliva building up in your throat, is a sign, is the earliest sign that you are really reacting to something in that food. It may not be everything in the food, it may be just item, one item. The reason I'm saying that is this: when everybody loved bread, I mean, I love bread from the smell. Like when you smell a freshly baked bread, man, I didn't even care that it was making me sick. I remember when I was a child, when everybody was, happy to be given bread. I would be hiding mine to give away to somebody because I knew it wasn't making me feel good after I ate it. But until I did the allergy test, I didn't know I could have any allergy to something like that. I mean, how could everybody enjoy eating bread and I'll be not able to eat bread? I'll be begging somebody to take my bread. Like, do you want my bread? They look at me funny, like, everybody loves bread. Why how can you be giving your bread away? But I did, only to find out I've been allergic to wheat. Wheat. Everything made from wheat will make me feel the same way. I will feel like a lump in my throat. No matter how much water or hot things I drank, I'll still feel that lump in my throat. I mean, the same feeling I'll feel when I ate peanuts, the same feeling I will feel when I ate anything that has soy in it. And don't ask me how I used to enjoy Chinese food. Oh my God. I was sharing with Dr. O, man, don't see me when I'm on to eat Chinese food. It will be like I'm drinking gari because the soy sauce that I'll put in it, it will be like everything else is suspended in soy sauce. because I love the taste of soy sauce. I didn't know that I was allergic to soy. So my recommendation is, please, if you eating anything, I don't care how you like that food, and you begin to feel a thick saliva building up in your throat, it means you are reacting to that something in that food. I think to your best interest would be to just just let it go. Unless you already knew and you just want to start building tolerance to that food over a period of time. But if it hurts you in the way, I don't know whether that makes sense. But that was just something I wanted to add to it. That please be on the lookout. Everyone has some kind of allergy to some food.
Great point, Dr. Jagbe, but you cannot develop tolerance to the food you're allergic to. The more you're eating it, the worse rather, the symptoms will become. Dr. Jagbe, when I saw his allergies, I mean, it's crazy. Think of a Nigerian who is allergic to rice, to tomatoes. Everything, all the sauces we cook, we put tomatoes in, whether it's vegetable, whether it's just red sauce, we we put tomatoes in it. And he's an excellent cook. He has taught us how to cook here on Medical Mondays. Was eating tomatoes. My first instinct was, I mean, the medical instinct that I went to school for, God given, was to refer him to an allergist to start allergy shots, which somebody with that magnitude of allergens, I've not seen anyone like that, even still now, till now. Um, we start allergy shots, they have to go every week for 2 to 3 years. He said no. And that was when I said, so what are we going to do? What are you going to do? He said, give me some time. Um, I'll keep updating you on what I'm doing. And like I said, he went to the store. I remembered once when he came to visit, and of course we have soup and everything. I'm like, Dr. Yago, we have nothing to feed you. He said, oh, do you have bell peppers and onions? We're like, yeah. You have fish? Yes. Dr. Ajagbe cooked soups, the sauce with bell pepper and onions without tomatoes, and it tasted better than the stew with tomatoes. He substituted rice with quinoa. Quinoa is a grain, and it's healthier actually than than rice. And he's been able to do things like jollof rice, fried rice, because it carries us along so that we can learn too. So this goes beyond just his allergens. You'll be wondering why he comes up with all these things, that he shares on Medical Mondays with Dr. O. He has shared with me that it's because of his life experiences that he did all these researches that is he now started giving to us for free. So, with quinoa, he will cook it like jollof rice, like fried rice, and sometimes put nuts in it that he tolerates. And it's been
Raisin,
fantastic.
raisin, crazy, and stuff, and flaxseed.
Flaxseed, and he's doing fantastic. He has not been on a nebulizer treatment. When I first met him, the day I met him, he said he gets on the neb treatment 3 to 4 times a day. I'm
Yeah.
like, whoa, that's no life.
hmm
And I remember telling him, come to see me and we'll fix you. You remember that?
Yeah, what she told me was very interesting. She said, this is not acceptable for anybody. So I'm looking at her like, who are you? I didn't know who she was. I didn't even know exactly who she was until she said, well, if you give me permission, I will be aggressive with this situation. And I'm looking at her like, okay, I've been to allergists in Howard, so there's nothing, I don't have anything to lose if I come to you. So I went to her based on that promise that she said, look, I'll be aggressive. But the first experience she had with me was scary because the receptionist ran to get her. I come, 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 Dr. O, because I couldn't breathe. Just because air freshener was sprayed in their reception when I came in, I, they had sprayed it before I came in, but it was just still fresh. So you can imagine if Dr. O wasn't prepared, what could have happened? They would have had to call 911. Ambulance would have taken me to ER just to get me opened up. So thank you, Dr. O, for being aggressive.
Thank God. We thank God. God is the one that gives doctors, all of us, the wisdom. We're just vessels that He used to attain His end. And I'm grateful. I'm grateful for you being here. I say it all the time. The day I'm happy with you, I tell you, what a miracle. Because I really don't know how you survived in, speaking about
Yeah,
cancer.
I shared it briefly that I was always in the emergency room. I mean, some hospitals already knew me. Once they saw me, they said, "Oh, here he comes," because they knew I was already in status asthmaticus, severe asthma, unable to breathe. So the thing about it is, when our body is telling us something, we should choose to respond to it. Many times I ignored my body before the diagnosis was very clear. I'll say, well, I don't care. I'm enjoying this stuff. So I'll keep on doing it. I'll keep on enjoying it, only to find out it was detrimental to my overall health. Despite the flavor, the taste. So I think, mine should just be a learning a prompt to people who may be borderline. Maybe you have been, experiencing things that you don't know how to explain. It might not be too bad for you to ask for a panel allergy test. The funny thing was, I used to think that I was allergic to pollen. I thought the dogwood, ev- because I had a dogwood plant in front of my bedroom window. So I thought that was where the problem came from. By the time I got the result, do you know there was no allergy to environmental?
Mhm.
There was no pollen involved. In fact, now I can sleep under dogwood tree and not have any wheezing or any sneezing, nothing. Now, I want to use this opportunity to also share something that I discovered. I didn't synthesize, I didn't manufacture, I didn't do nothing. But based on my research, I discovered that most of the bronchodilators that are available, that is, medicines that we use, anyone who has asthma, that always wheeze, anyone who does that and is always wheezing, no matter how much medication they've taken, there's simple natural product that's available. It may be a little on the pricey side, but it's called black seed oil. If you've seen it before and you didn't know what it was doing, I can tell you it's one of the miracle gifts that God has given to mankind. If anyone has suffered from asthma, and I'm saying it categorically because it's supported by evidence, if you have not been really relieved, I'm not selling anything. I am not selling black seed oil or the product that comes from black seed oil. I don't have any financial interest, but I know how I felt. Haven't been exposed to black seed oil. It is one of the best bronchodilators, but the big pharma can.
Bronchodilator means something that opens up the lungs so one
Yes,
can
it
breathe.
opens the airway. It opens the lungs primarily. So it contains a chemical called thymoquinone. The big pharmaceutical companies could not lay claim on it because it's natural. So it will be a lot cheaper for anyone who is suffering from bronchospasm or wheezing all day long. Just try it. I'm using it on a daily basis, and I don't use more than two teaspoons a day. It stabilizes. It's an immune modulator. So just in case you have somebody who has been going through this and nothing seems to be helping, give it a try. If you need to know the dosing, I can send it to you, or Dr. O can share it with you. I already sent a copy to Dr. O. The dosing from infants to adults. So you can see that this can be is a I would call it a game changer for those who have airway problem.
Thank you so much. Thanks for sharing, Dr. Ajagbe. And I want to remind you, we're not establishing doctor-patient relationship on this platform. We're just sharing information that is authentic and legit. Dr. Izugu, kindly unmute. Thank you. Welcome.
Thank you. Thank you,
Oh,
guys.
easy.
Captain himself.
Oh, easy.
My brother, thank you so much for really sharing the story. And Dr. O, thank you for always being straight with the patient because there's no way around it. When you tell them exactly what they need to do. Now, what Ajagbe has really underscored here is the importance of disease management. And in disease management, prevention is doable by anybody. You who is sick have to take charge for the prevention. And in the step of doing that, you have to listen to what your body is telling you. Nobody else can really tell you that. Things you put in your body may tell you, I don't like it. Understand it doesn't like it, avoid it. You can be a diabetic and you have your CGM on you. You eat something everybody has been eating and your sugar spike. Stop that. You can even eat some food and your blood pressure just shoots up. You say, well, but John ate it and didn't do anything to John, but it's doing something to you. Stop it. Change. You'll find that if you monitor and manage diseases, you'll be on top of it. It will not be on top of you. But if you let any disease take over you, it can really, really kill you. Asthma can kill people. It can give you, you can lose your brain function very quickly because you didn't have the oxygen or whatever.
Absolutely.
But here he has managed this thing by just, I have seen Dr. I've been to, meetings, okay? People are serving food, right? He bring his own food for the whole function and sit on his own corner and eat that. That is discipline. And we need that to really, this body have to discipline and manage his body. Thank you so much. I appreciate you.
Thank you, sir.
Thank you so much, Dr. Izugu. Thank you for bringing that up. Look, we go on medical missions out of the country to Nigeria. Dr. Ajagbe brings his food from the US, packaged, and he will carry his flask. Doesn't bother anybody. I don't know how this man does it. And he would eat his food separately. So it's when you love yourself. And look, I'm a Jesus lover. I love Jesus with a passion. And in scripture, it says that your body is the temple of God. So anything that you put in the body that causes you trouble defiles that body. The Bible says your body is the temple of God and it must not be defiled. So that's really the principle he's living by. He knows what would defile his body and is abstaining from them is discipline. So if we have anybody on the platform tonight, you know that this thing is not good for you. Even for weight, you know this thing is causing weight gain. You need to lose weight. Stay away from it because weight defiles your body. It defiles the temple of God. So just stay away from it and you'll get excellent results. We have a living testament here in Dr. Ajagbe. Thank you for bringing that up, Dr. Izugu, because I didn't even remember that part. Thank you. So somebody is asking in the chat box, what brand of black seed oil do you use? There are so many brands available. Any recommendations?
Well, it depends on where you are. I go with the um, the organic store brand, since that is their goal. their goal is to make sure they have organic products. I go with the one that Moms has. Moms, which is my what does Mom stand for again? And it's Moms like Roots grocery store. They are organic stores, but I think you can get anyone that they wrote organic on it. You have to take it by faith because we don't really know how organic their organic means. But I go with the store, brand because if their goal is to give to supply organic products, I assume that they have vetted what they have on their shelf. So I'm going by faith too. I can't really vouch for it because I don't have a lab to test to be sure that it's really organic. Now, most of the bottles should show you that it contains thymoquinone. Thymoquinone is just like quinine, but thymoquinone. So thymoquinone is what you look for on the bottle. If it contains it, that's what you want.
MOM.
No,
Meaning, no.
thymoquinone.
MOM. I'm saying mom. I'm saying means my organic market.
Exactly. Yeah, that's what I was trying to remember. My organic market is one brand. You have Root is another brand, and I think you can get from Trader Joe's if you have Trader Joe's in your or Whole Foods. Many of the high end grocery stores will carry it.
Actually, we have on the platform Dr. Lola, who is a pharmacist and sells, this organic stuff. She sells organic. If you please put your information in the chat box. Dr. Lola Adebanjo is who I'm referring to. If you please put your information in the chat box, I think people can get the,
Black seed oil from them.
black seed oil, and it's organic. She sells organic. Maybe that would be helpful.
Is
So,
Dr. Is Aromolano to a pharmacist? Lola Aromolano.
no,
Yeah.
she's not.
Oh, okay.
No. Dr. Adebanjo is the pharmacist.
Pharmacist.
Yeah.
Okay.
So I was just alerted a few minutes ago that the 13th of October is also a holiday, Columbus Day, which is Monday. So we're going to be taking off next Monday, the Monday after that. We're having 2 weeks break from Medical Mondays for the first time in almost 5 years. Isn't that something?
Mm.
But don't worry, I would alert you. I would send text messages and email to alert you. Geez, we're going to go into withdrawal. So in the chat box, www.hopeforallpharmacy.net. Hopeforallpharmacy.net is it's a website, and you can get it there. So, and again, that's a natural product. Dr. Ajagbe shared some research on this because a lot of the natural products don't have research basis. And I'm always leery. If it's not been researched, there's nothing to support it. I'm going to tell you, I don't know. But there has been some research done on black seed oil, and I think more researches are still being done. So, Dr. Adebanjo, yes, kindly unmute. You have your hand raised.
Yes, I'm recommending this brand. I know during COVID, a lot of people bought that brand and it really worked for them. And this one came from Pakistan, I think. The is written on the bottle itself, made from Pakistan.
And it's the Habogonic. Is that
Yeah,
it?
Herbagonic.
Oh, Organic black seed oil. Okay.
It works. I've used it too. I use it for cough also.
Yeah, bronchodilator.
I saw some other things because when Dr. Jagbe sent it to me, I actually looked it up, and it's actually, it helps also in cancer prevention.
Oh yeah,
They
that's
just-
why I say it's a miracle. It's a miracle
Mm-hmm.
product.
Mm-hmm.
I have monographs or something patient information on how black seed oil improves arthritis, glaucoma, and every other major illness that people are experiencing, and without any side effects. So if you are interested, I'll be glad to send them to you at no cost. So just let Dr. O know, and then I'll send it.
Thank you so very much. Are there any other questions or any inputs, stories that you want to share? Otherwise, I'm going to defer to Dr. Elisha to please give us a parting words. I'm missing you already for 2 weeks. I can't believe it. Dr. Elisha,
Right. So, um, I guess Dr. We said a lot of this already. So what I want to say again is, let's just pay attention to our kids or any individual, even adults, because some adults just don't want to talk. They don't want to sound like a complainer. Every little sign matters, and let's pay them attention. Let us explore and let us not put our own feelings or judgments on people, because it may lead to life or death. Thank you.
thank you. Thank you so much. We appreciate you. And I'm so glad you are a success story. A lot of
Yep,
children
absolutely.
are not.
Thank you.
Thank
Thank
you. We
you.
thank God for your life too. Dr. Jagbe, over to you, sir. Oh, 1 minute, 1 minute.
Mhm.
I'm sorry. So this is Ma. So this may be for Dr. Elisha or Dr. Jagwe, maybe for you. It says that I'm told I'm allergic to aspirin years ago in Nigeria. How do I confirm this? Okay, I can answer that. When you were told you were allergic to aspirin, my gut feeling is that you took aspirin and you had an adverse reaction, meaning that something happened that a reaction happened that is one of the possible side effects of aspirin. That's what my assumption will be. I don't know who made this diagnosis. I'm saying this if the diagnosis was made by a physician or a clinician, it's because you had a reaction that is a possible reaction of aspirin. Unless you take aspirin again, and you would have the same similar reaction, and we wouldn't know. But if they say you're allergic to aspirin, I would just say don't take it. The testings that we have now, we don't have any that would test aspirin. I know everything the allergy testings check, and aspirin is not one of it yet. Maybe in the future, we would have an allergy test that would test that, but we don't have it. Unless you are exposed to it again, we won't know if you are indeed allergic. And again, my suggestion would be don't expose yourself to it. Don't take the chance because we don't know what kind of symptom you had that made them tell you that you shouldn't take it, that you're allergic to it. Did I answer your question? The only thing you know of is chloroquine causes you itching, yes, that's a possible side effect of chloroquine. That's fantastic. You know that. So again, I'll advise when you see a doctor, they ask, do you have allergy to anything? Yes, tell them chloroquine and tell them aspirin. If you take chloroquine now, you're going to have itching. If you take aspirin, I don't know what you may have. So, and the reason I'm saying don't expose yourself to it to find out is if the reaction you had was something to do with breathing, that when you take it, you can't breathe, or when you took it, then you couldn't breathe, the same thing would happen. And we don't want devastations to occur. If it's itching, well, you can get things that will stop the itching, over the counter even, and that won't kill you. But we don't want to take the chance. Did that answer your question? Thank you. Appreciate it. So, Dr. Jagbe, over to you, sir.
Yeah. Thank you again for the opportunity to share my story. I want to kind of just mention that many people react allergically to products differently. Some may overlap, some may just be one, and particularly when it involves breathing, that is more likely to cause, a very dangerous, fatal outcome if it's not well taken care of, which explains why Dr. O will always say, please, we don't know which of these episodes can be fatal. Always carry this, always carry that, so that when you are in a very precarious position, you can at least rescue yourself real quickly. And thank you for always sounding that. Um, I have experienced allergic reaction in many ways. I explained the first one was urticaria, which is hives, skin rash. If you found a child that's constantly itching, constantly scratching their body, constantly, and you see signs of scratching on their, the fold of their arm, like in front of their elbow, or you find it on their upper arm or their forearm or their legs, or some even on their faces, it's not because they just want to be scratching. Something is going on. And many times it's not as superficial, it's not topical. Because if it was topical, it would be easy to identify and move away from it. But many of the times it's from what they are given to eat, particularly if it's a child. A child is being fed by an adult, whether it's their parents or guardian. So if we as adults are very, very astute enough, I mean, very observant, we will be able to help these children uh, to stop suffering, because many of them don't even, like we've already articulated, they don't know how to express themselves. I've seen children that were being ostracized for scratching. Why are you always scratching your body? A child doesn't want to just scratch their body. The child is itchy. And if the child is itchy, she has to attend to that stimulus. So we need, as parents and as adults or guardians, we need to be very vigilant and help these children to grow properly. Some people will say, well, the only thing they observe in their life is not urticaria, but they experience eczema. Eczema can occur anywhere, but the one I've seen very commonly, particularly when we were in boarding school, is the one that will show on people's faces like two different colors and in the back, and people will be running away from them like coco ifo on me, ifo, like it's infectious. They thought it was infectious, but this is allergic reaction. I mean, allergic reaction, if it is not understood, will be treated with all kinds of stuff and it will not help. Fortunately for me, when I was a little baby, a little child, when they put palm oil on my skin, it helped. I don't know how it helped. Maybe it's because of the carotenoid or the vitamin A that was present in it. How it worked, I have no explanation, and I don't think I've seen anything in literature that describes how palm oil is an antidote to every disease in Yoruba land. Anything that causes ill health, the Yoruba people will say, go and get, oh yeah, give him palm oil to drink. Even if it is poison, they believe that palm oil is the antidote to everything. It did work when I was a child. I don't know whether it still works for some people now, but the scientific part of it, I do not know. I don't have any explanation for it. But we know something that can help now. And that's also another oil. And that's why I just mentioned this evening for those who have never heard about black seed oil. So, allergy is not a joke. And I'm thinking allergy will be primarily the most common reason why children are non-compliant. And if children are non-compliant because their body is making them to reject some things, and the parents are looking at them as being very stubborn, very heady, and so on and so forth. They give them all kinds of names. I think parents should begin to see things from the standpoint or the point of view of of those children, so they can be truly helped. Thank you.
Thank you so much. So much appreciate you. There are lots of thank yous on the platform. People appreciating this session and how informative it is. And we appreciate you all too. Medical Mondays hold every Monday except for holidays. And we're going to be taking off next Monday and the Monday after, 2 weeks in a row, and we'll resume back. Dr. Jagbe, what Monday is next? I will be resuming back. While you're checking that, I wanted to also say, if you'd like to be informed,
10:20.
10:20. Thank you. Thank you, Dr. J. We'll be returning back on October 20 and to continue with Medical Mondays. We have the same link. The link is the same. If you have it now, it's the same every Monday, but
Mhm,
topics and speakers may differ.
mhm.
And if there are no more questions, I would say please stay safe, enjoy Columbia Day, and enjoy your week. Stay safe. COVID is still raging. I'm seeing a lot of, a lot of upper respiratory symptoms that are actually COVID. So please continue to stay safe and